Yes. I'd like to thank this group for being invited. I'd like to thank Representative Myers and Wheatley. I don't have the loudest voice, so I'll try to speak up. And a panel. I mean, everyone here, I believe, really is concerned about the life and welfare of citizens of Pennsylvania. I've been a lifelong resident. I grew up in Stilltown, Vandergrift, at the medical school in Philadelphia, trained at St. Francis in Pittsburgh. I've been in the field of medicine over 43 years. I started with Dr. Adrian Tversky, my mentor at St. Francis in the addiction field over 29 years ago. I've been full-time with Gateway Rehabilitation Center for over 21 years now. We now treat over 1,500 patients a day in our region for addiction. The problem is growing. I end up treating a lot of the people that other people don't want to treat. My friends who are colleagues who are physicians say, how could you work with those people? I work with the IV heroin addicts who have HIV and hepatitis who are homeless, and people doing cocaine. And yes, sometimes people addicted to marijuana. We do see marijuana addiction. But I also try to push the envelope. Until we're getting 100% success, I say we need to look for more tools in our toolbox. I've been a big advocate for exchange, harm reduction in terms of naloxone. And in terms of the issue with marijuana, I'd like to start off by saying I do believe that marijuana, more correctly, some of the components in marijuana do have medicinal value for a number of conditions, from nausea and vomiting to appetite stimulation with aids wasting, to a number of neurological conditions, to pain, to headache, to seizures. I also believe that people who are trying to receive help for legitimate medical conditions and the healthcare providers trying to provide that should not have to fear prosecution in trying to do that. And honestly, I believe in compassionate care for people who are suffering. There are many people who are suffering, and we may hear from some coming up that they are suffering, and marijuana does help them. And we owe people suffering our best. But yet I am against this legislation for the reason that I believe there are more responsible ways to provide for that, to provide for medical care. And I will give you what I think are some solutions. I know you're looking for that. You have the time, and I got a lot of information here. If this is truly a medical issue, and we're trying to call marijuana medicine, then why don't we treat it like we do any other medication? For instance, if you're sick tomorrow and you go to your physician with certain symptoms, and your physician is thinking of a medicine to use, well, that medicine has been FDA approved. Well, how does that happen? First of all, there has to be information, anecdotal stories that say that something can be helpful. There has to be some studies showing that. And then the FDA approves a Phase system. Phase 1 trials are limited. You look for, is there toxicity? Is it safe to continue with it? Phase 2 are larger trials that look for, is it effective? Is it doing what we say it does? Is it still safe? They're always looking for safety and toxicity. And Phase 3 are larger studies that really try to tease out things like, what is the best way to give it? By mouth, by a spray, by some other form, maybe IV medicine? What doses work best? What are some side effects? And then it gets approved. So your doctor has that available. And if he has questions about you, he has books that he can go to and look at what is the proper dose, what are the risks and benefits, what medicine interactions does it have with other drugs. This bill is going to bypass all that. Okay, it's going to say no. That's not going to be available to your doctor. The next thing your doctor gives you a prescription, you go to a licensed pharmacy that has quality controls to make sure you're going to get that dose that your doctor ordered. You have a pharmacist there who's going to be able to check with your database with other medicines. Your doctor may not know that you're getting prescription of Xanax and Vicodin from another doctor down the street. There's a safety mechanism built in place through pharmacy. This is going to bypass that. And I'm saying that is not responsible. Now, why are we at this point? Again, the medical issue. Part of the reason has been the federal government. I think people are at this point because the federal government has made it hard to do the legitimate research over the years. Both parties, historically. And And a lot of it has been driven by, as Dr. Webb says, the reefer madness hysteria. And the time for that to come it should end now. I think our current administration, I know, is much more open to looking at this logically. The errors of the past of restricting adequate study were wrong, okay? But it is also wrong to bypass that and say, we're going to do an end run, we're going to go rogue on this and bypass the system. Two wrongs don't make a right. And I'm sorry, I mean, most first graders know that. I offered you an op-ed that I wrote to the Pittsburgh Post-Gazette. I just found out I was going to be involved with this yesterday. I had patients to see late into the evening today, so I didn't have time to refine it. And where I make some of my comments, and I should say the week after I sent in this op-ed, there was a reply. It came, I believe, mainly from the marijuana lobby, and they actually posted it on their website, being critical. They said I had important factual errors. Well, actually, there was only one sentence in which they said I had factual errors, and they commented on 3 points. I did say use of marijuana can make you a more dangerous driver. Is that a factual error? Does it make you a safer driver? It reduces reaction time, coordination. There's a such thing called drug driving. The RAND Corporation did a study on what could be the impact of legalizing marijuana in California, which is a pretty conservative with their information, at least I believe they are. They estimated that if marijuana goes totally legal in California, there would be a minimum of 60 more fatalities a year. Now, that's a big state. That's maybe not a big percentage of people, but it's certainly relevant to those people. And yet, for regular users of marijuana, their impairment in driving lasts beyond 24 hours from their last use. So I think that's an accurate statement. I also made the statement it may increase your rate of respiratory illness, and they challenged that, saying, well, it's never been proven that it causes lung cancer. That's controversial. There's been some studies that say it does lung cancer. Most experts do believe that there's a connection with lung cancer. It's hard to separate because so many people also smoke cigarettes. But clearly, this is a plant you're lighting on fire, that you ingest over 400 chemicals. It has 4 times the amount of tar of nicotine. It can contribute to respiratory infections, pneumonia, bronchitis. I think any 9th grader in health knows that smoking your lungs is not a good thing. So I would think that that's also a concern. Again, these aren't reasons to say we should not look at marijuana as a medicine. There are reasons to say we should look at it in a responsible way. The last thing I commented on is may increase your rate of schizophrenia. I realize that's the most controversial one. There's been a variety of studies. They cited one study that just said, well, it causes funny thoughts in some people. Well, funny thoughts can be hallucinations, delusions, depersonalization, derealization. It might not be so funny to those people getting it. There's a study in Sweden that looked at 50,000 people that showed a significant increase. Study in Great Britain of another 1,000 people looked at a 10% increase, especially with young people in the developing brain. And the last speaker was correct in saying there is a critical time in development. Harvard Guided Psychiatry showed that teens who use marijuana as little as 10 times more than doubled their, there was a Harvard mental health letter, to be correct, more than doubled their rate of schizophrenia, an area of controversy. And the expert that they used to comment on it was Dr. Mitch Earlywine, PhD from Albany, New York. Very engaging speaker. I agree with a lot of things that he says, but not on this issue. He did disclose that he is a psychologist from Albany. He did disclose that he's on the advisory board for NORML. He also did disclose that he's on the advisory board for Cannabis Science Inc., a for-profit company that makes marijuana products and makes has public stock that sells, and they make money for selling marijuana to states that provide it. I'm not saying that biased his opinion, but I think that should be available. I will admit, and I will disclose it, that because I work in addiction, I may see the world from a different point of view. I may be very much have a skewed point of view because of what I see a part of the world every day that a lot of people don't see. People who work in emergency rooms tend to wear seatbelts also. Let's just talk a minute about the elephant in the room here. Okay. Most marijuana used in this country is not for medicinal purposes. It's to get high. I mean, that's the point. People don't use marijuana because it's going to increase their heart rate or affect their lungs or affect their lymphatic system. They use it to get high. And if you want to make that a legal thing to do, that's a separate issue from the medical issue. Yet, there are many other medical conditions and drugs being studied that don't have anywhere near. You can get maybe 2 people in this room to support some of those. And I wonder if that's because you can't get high from those things. And that might be something. Again, that's not a reason not to study marijuana as a medical thing, but it's a reason to look at it responsibly. The Institute of Medicine, I encourage you to look at this book thoroughly. It's probably one of the best written, Marijuana in Medicine, by the Institute of Medicine did a big study. Now, it was in 1999. The sad thing is the science has moved very little since then because of the restrictions in the federal government. They did conclude that there are medicinal properties. We also have to remember, we're not living in the year 10,000 BC. We're not on the moon. We have many other medicines. They concluded, although there are medicinal properties to them, that for the most part, there are other ingredients that are there are other medicines in almost every instance which are better, and that the effects of marijuana at best are modest. We do have other medicines. They also said there's little future in smoked medicine. And smoked medicine is harmful. The active ingredient in marijuana, THC, as Dr. Wentz said, the delta-9 tetrahydrocannabinol, already is available in an FDA-approved medicine, which went through all those steps. It's indicated for nausea and vomiting associated with chemotherapy, and AIDS wasting syndrome to help stimulate appetite. There are people who do benefit from it, but because it is an oral pill, you have to wait for it, and many people prefer other forms, especially people with nausea. It's a tough medicine to take. As one of my patients said, who took it and said it was helpful, and he did smoke marijuana. I said, which did you think was better? And he thought they were about equally as good, but he said, marijuana was more fun. And again, that's okay, but that's not science. We also, you heard from Dr. Greenspoon about Sativex. This is a medicine that's approved in Canada, recently in Great Britain. It contains THC and cannabinol, another ingredient in marijuana, and it's very promising. It shows, good studies showed helpful for a lot of the neurologic conditions, for pain, for multiple sclerosis, for nausea, vomiting, and it comes in a oral mucosal spray, which is a big advantage over the marijuana use. And but one thing about it, though, is with the way they have the ingredients combined, it seems to lean heavier on giving medical aspects, but minimal on getting high from it. But because this is so effective, I'm wondering, where is the outcry to move this ahead? Why isn't there so much energy about, let's move this medicine, which can accomplish the goal of helping people who have these symptoms? Maybe it has something to do with, you can't get quite the high from it. If that's the point of what we're trying to do, is this a Trojan horse? I think for some people it is, for total access to marijuana. But again, that's outside of medicine. You're dragging doctors into this. I'd rather stay within, as I say, inside the ropes. And just kind of round it up, is marijuana addicting? For some people, yes. Lifetime rates of addiction, that means having continued use in spite of adverse consequences, is about 9%. It's lower than for other drugs, even slightly lower than for alcohol, certainly lower than cocaine and heroin. But for those people, it definitely is effective. And yes, with higher THC concentrations, we are seeing physical withdrawal symptoms in about 50% of people with marijuana. We weren't seeing this 25 years ago. Now they are mild. They are jitteriness, not having seizures or TTs, but they are mild. Also, as far as meeting criteria for what's called abuse, they estimate for people who used marijuana last year, about 16%. Abuse, meet criteria for abuse, that's harmful use. That's operating machinery that's dangerous, maybe driving a car, about 1 in 6. It's not a reason to not study marijuana, but it's a reason to study it responsibly and stay within the ropes.